There's going to be some surgeon out there who just wants the money, let's just face it. Is plastic surgery safe? What makes a good candidate for plastic surgery? Will I regret having a procedure done? I'm a double board certified facial plastic surgeon, and today I'll be answering the web's most searched questions about plastic surgery. Are plastic surgery results permanent? What we generally do is reposition tissue, we cut out skin, and we sometimes put in implants. So after doing all that, unless you try to reverse it with more surgery, it's rare for things to go back to how they were before you made the surgical change. Though I would say that most results are semi-permanent in that our bodies are constantly changing and the aging process continues. So adjustments to prior results might be necessary to maintain the appearance. For example, take a rhinoplasty procedure. Let's say after surgery, you're very happy with the result and it's been a year and everything looks great and you're delighted. That's awesome. But what you'll find is that over the course of the next 5 years, 10 years, 15 years, 20 years, as the face lengthens and the skin starts to change and all the cartilage and connective tissues start to weaken in our nose, the results of your rhinoplasty might not look exactly the same. And some people end up going back for revision surgery many years later because of some of these changes that have occurred. Is plastic surgery safe? It depends on a number of factors. The first is the surgery type. When you compare something like a facelift versus a lip lift, in general, the smaller surgery is going to be safer. For example, a facelift comes with certain risks such as postoperative hematoma that can truly be life-threatening at times, and say nerve damage to the facial nerve, types of risks that we don't really see with lip lift surgery. So the surgical type definitely is relevant. Another example would be a Brazilian butt lift. That procedure carries the greatest incidence or mortality compared to any other plastic surgery around the world. So getting that compared to, say, getting a breast augmentation, of course, the Brazilian butt lift is going to be the riskier option. Another factor is the type of anesthesia that's used. You can get a procedure under general anesthesia, and sometimes you can get the same procedure under local anesthesia. The local anesthesia option is going to be safer because you avoid the risks associated with getting put under. So there are real risks with anesthetics, and that could be a bad allergic reaction. It could be changes in your blood pressure, for example, changes in the rhythms of your heart, things that aren't really that common or relevant even with local anesthesia procedures. But again, there are certain surgeries that can't really be performed under local anesthesia, so there aren't really any choices there. You just opt for the general anesthesia option. But it's always good to find out. Sometimes there are surgeons who will offer a surgery that you might be interested in, where most people say general anesthesia, but that specific surgeon might be comfortable with local anesthesia. And if they can keep you relaxed during the surgery and still do it under local anesthesia, then that might be the best course of action. I think the facility also plays a role in the cleanliness of it, in the use of proper protocols to maintain patient safety, and also in the accreditation of the facility. There are various accreditation bodies that help maintain patient safety. And when a facility has that said accreditation, they're going to be more likely to follow all the right steps and procedures to make sure that patients do as well as possible. And safety also depends on the surgeon, of course. Their level of skill and degree of precision, of course, is very important when it comes to executing your surgery and keeping you safe. I think also the number of surgeries that they do every day is highly relevant. So a surgeon who really just packs on as many cases as possible in a single day might be doing extremely safe surgery. But of course, for efficiency's sake, they might be cutting corners here or there that might make the procedure overall less safe for any one individual. And these are questions that you should feel comfortable asking your surgeon in advance, and also maybe his office, to see how safe your procedure might be. What things can I do to combat the aging process without having surgery? Well, the most important factors are going to be diet, exercise, and sleep. Optimizing these three things, of course, will impact every facet of our life, but it also leads to people aging better. I think having a positive outlook on life also leads to overall better aging. Skincare is extremely important, and this includes topicals such as sunscreen, for example. It also includes things like lasers or chemical peels that can lead to your skin looking as vibrant as possible. Injectables can sometimes play a role as well. So things like Botox, filler, Sculptra that we've covered in many videos can all help with some of the aging sequelae. And of course, there are various tightening devices. And we've covered this in a video called Facelift Without Surgery. So check that one out. Will I look unnatural from getting plastic surgery? Well-performed plastic surgery is actually designed to maintain naturality. And this is actually in contrast to some injectable procedures, for example, where oftentimes people over time might look less natural. So take fillers, for example. And if you use fillers in the lips, what you'll find is that over time, you can get anterior projection of the lip and the kind of ducky appearance. And that isn't a natural type of look. But in contrast to that, if you do a lip lift surgery and you reduce the philtral length, the lip appears still flat to the face after the swelling is gone, and that can result potentially in a more natural appearance. But again, it's a case-by-case basis. Some people are better candidates for a lip filler and others for a lip lift. I think technique does matter for creating a natural appearance. As the surgeon, you need to know what your optimal goal is. You need to know how to work with all types of various tissues to create natural results. And recreating nature is sometimes quite challenging. So in order to do so, you need to first understand what the natural configuration is and then try to reconstruct that or rebuild things to get closer to that state. I think proper patient selection matters as well. As a surgeon, you need to make sure that you're picking the right patients for the right procedures. That, of course, also leads to more natural results. I think it's also important not to change someone's face or body too much. You want to keep the person looking like themselves, just an improved version, but you don't want to completely change them into a whole different person. That then looks unnatural for that individual. Do people regret having plastic surgery? This most often happens when the expectations don't necessarily match the outcome. It's very important for me preoperatively to understand people's wishes and their expectations so I can make sure that they are a good fit for what is technically possible. If those two align, then it's okay to proceed to surgery, and then things generally work out fine. But if those two things misalign, then that's a recipe for disappointment and regret. Also, with the initial recovery, some patients do regret having had that surgery, but that's typically temporary. How long will it take me to see results? Well, it depends on the specific surgery and in the patient's healing time. Generally on the face, it can take at least a year for you to see your final results, but usually within the first few weeks, you have a sense of where things are headed. And the reason it takes a few weeks is because in those few weeks, you are bruised and swollen, and it's hard to tell exactly what the outcome will eventually be. But it's important to stay patient in the early recovery and not jump to conclusions too quickly. Trust in the surgeon that you initially selected, and if you're having any issues or concerns, make sure to address it with that surgeon. It may be difficult to tell in the early period after surgery if the surgery was unsuccessful or if there's just a lot of swelling early on, and that it will all improve. So if your surgeon tells you that we have to wait and see and give it another few months or longer, trust in that. And of course, you can always get a second opinion, but most of us as surgeons want the very best results for our patients. I mean, there's typically alignment there between the patient's wishes and the surgeon's wishes to do a good job. So if you're being told, you have to give it time, and try to be patient with that. But if you're told that at the next visit after and it's already been months and months, then maybe it's worth seeking out another opinion. What is the best age to get plastic surgery? For cosmetic plastic surgery, it's important for the patient to not be too young. Many times people will have a surgery in their youth and then later on grow to essentially regret that early decision, because as they mature, they start to have a different appreciation perhaps for their appearance and just the overall kind of state of affairs. And that's something important to remember. It's good to let the body and the mind mature until you reach a point where you can make a very informed decision. And for older patients, it's imperative to make sure that their health is appropriate for the planned procedure. And like I said earlier, local anesthesia, whenever possible, is going to be your safer option. How do I know if I'm a good candidate for plastic surgery? You can and should thoroughly research procedures that you're interested in. You can, of course, go to different trusted websites to read about them. You can watch relevant videos. You can also go to forums or get connected with people who've had the same types of procedures. That is, of course, all good homework to do. But ultimately, you'll have to have a consultation or sometimes a series of consultations with board-certified surgeons who can help determine if you're a good candidate. I often do recommend multiple consultations so you can take that information and make an informed decision. Keep in mind some surgeons' bias to sell you surgery, and take heed when a plastic surgeon tells you that you're not a good candidate for a specific procedure. That's important information, and it can happen for a number of reasons why you're told that. It could be that the surgeon just doesn't have much comfort with that specific surgery because they don't do it that often. It could be that they determine that maybe you're not the right fit for their practice for different reasons. And it could also be, though, that they just don't feel that you have the right anatomy for the procedure that you're interested in. All of that is useful information, and I think people should take that to heart and really try to internalize that information, because what I find is that there are many patients who will just jump around until they're told yes. Someone will inevitably always say yes, because this is a cosmetic surgery that's more out of pocket, and there's going to be some surgeon out there who just wants the money. Let's just face it, right? So just be wary of someone who's just yes, yes, yes to all of your requests. How do I choose a plastic surgeon who is right for me? First, I think that it's really important to find a surgeon who has expertise in your specific procedure of interest, and someone who does that procedure often, because there are many people who are like generalists and they're very good at many different procedures, but they're not necessarily the best for that specific procedure, and you might still get a really good outcome. But again, your chance of success is going to be higher with someone who's doing that same surgery time and time again throughout the week and is generating excellent results. So again, it's not enough for someone to call themselves a plastic surgeon or to even be a board-certified plastic surgeon. When you're looking for a specific procedure, try to find someone who's an expert in that specific procedure. Location can be important. Some people are willing to travel for surgery, and sometimes that means because they want to pay less money, and sometimes that means because they actually want to pay more money because they're traveling to someone who's considered, say, the best in the field. But some people really don't want to travel and they rather stay close to home. And there are some advantages to staying close to home as you recover from a surgical procedure for obvious reasons. So having your friends, family around, and having just the comfort of your own home can be a big plus when you're considering where to go. I think personality fit is very important. At the end of the day, you want someone that you can trust. And so you're looking for the right personality fit. Some patients do really well with a boisterous, in-your-face type of surgeon who tells you exactly what you need and tells you you're going to love it. Doesn't really, talk about any risks per se, and just kind of glosses over that. But that type of surgeon might make someone feel like they're, surgeon's in control and everything will be fine. But for a different type of patient, they might be intimidated by a personality like that, and they might want someone who actually spends more time and really kind of guides you through the process and what are the pros and cons of the procedure and really listens to your needs. So again, you're looking for someone who you have a great fit with personality-wise, and someone who you can trust not just with your aesthetic result, but also with your life. Budget, of course, is important, right? You need to know how much you're willing to spend on said plastic surgery. If you're looking for someone who's considered the best in their field, of course they're going to be more expensive because they're more in demand. So if you're looking to save money or really go for a more affordable procedure, then you have to expect that your surgeon may not be as well known, or might be in a country where the cost of living is lower, something along those lines. So really have your budget in mind and see which surgeon fits best within your budget. Make sure to check before and afters for the procedure that you're interested in before, of course, signing up for surgery, and even before setting up the consultation. And some people just go straight to Instagram and look at the photos in the feed, but remember that most plastic surgeons will have a website, and on their website there's a gallery section, and that's usually where you can see the most comprehensive collection of their before and after photos. Some surgeons will have even more before and afters for you to see once you're in their office, but that's not always the case. For me, for example, whatever I have to share that is, publicly available that my patients in the past have agreed to showing is all available on my website. Make sure to check out reviews. Reviews can definitely give you a lot of information, but keep in mind that there's all types of reasons why some surgeons have bad reviews. That might be, of course, because some results that didn't work out as well, or maybe their temperament or the quality of their office. But also keep in mind that sometimes it's a competitor to that surgeon who might go and write something nasty, or maybe a patient who called in for information and didn't like the price that they were given and went and bashed the clinic and bashed the plastic surgeon because of the prices that they have. Remember that if for a plastic surgeon to comment on someone's review is actually oftentimes a HIPAA violation. It's not like a restaurant where a patron might be late for their reservation, and then they go and write some nasty review, and the restaurant owner can go and say, no, they were actually 20 minutes late, that's why they were seated late. Plastic surgeons and their offices can't always write a rebuttal to what someone has said. So please keep that in mind. You want to make sure that the facility overall looks clean and well taken care of. Sometimes you can glean this just from photos online, and other times when you go in for your consultation, look around. Are the garbages overflowing? Are there weird stains in places where, you wouldn't want to see them? So that usually is quite telling for how the office and the surgeon operates, in my opinion. So a place that's very clean and well manicured is oftentimes a reflection of that surgeon, and I think it should be an indication that they're going to put that same degree of effort into the actual surgeries. And of course, make sure that there isn't a litany of lawsuits that have been brought against the surgeon over the course of many years. It's very common that over the course of a plastic surgeon's career that they might get sued here or there. But if you're seeing a pattern of lawsuits and they're all related to the same theme, then that might be something that you should take into consideration when you're making a decision. On our Feel Confident website, we'll soon have a beauty experts section where we'll be recommending plastic surgeons with expertise in specific procedures, such as, say, a facelift or rhinoplasty. Because oftentimes people come to us and they ask, where should I go for this? Where should I go for that? So now we will send everyone to this one place, which will be, I think, a nice comprehensive guide that we'll keep updating as time goes on. How should I prepare for surgery, and what will recovery be like? Preoperatively, you want to make sure that you optimize your diet for healing. You need to avoid anticoagulants, and that can come in the form of medications or supplements, and it can also be found in various foods. Like spicy foods are more likely to thin your blood. Different drinks like alcoholic beverages can do the same. Oftentimes you'll be cleansing with something like a HEPA-cleanse if it's suggested by your surgeon to decrease the bacterial load on the skin. And you definitely want to make sure that you have all the supplies that you're going to need after surgery prepared before you even have the surgery. And make sure you arrange enough time off of work, and make sure that you have all the right help that you'll need to properly help take care of you after surgery. Post-operatively, of course, it depends exactly on the type of surgery that you had, but all surgeries will leave you with some degree of bruising, swelling, and discomfort for a few weeks at minimum. Always be on the lookout for potential complications. This can include bleeding, infection, nerve injury, or other complications. And keep in close communication with your surgeon and his or her team. Routine follow-ups are important, so don't skip those. You might think that everything looks great, but you might be missing something, and if your surgeon picks it up sooner, then they might be able to remedy that and give you a better long-term outcome than if nothing was done for a long time. How many preoperative appointments will be needed prior to surgery? Some offices do virtual consultations first, while others have in-person consultations first. Any in-person consultation should be at least optional, before you have to make a decision to have surgery. If you're being forced to make a decision only off of a virtual with no option to meet your surgeon in advance, then I think you need to consider that, factor that into your decision making on whether or not that's the right place for you. Just to restate that, so even if a virtual consultation is the way that the initial consultations are done in that office, which is the case with my office, there should at least be an option for people to come in if they choose. Sometimes that might be requested by me, for example, because I can't tell, exactly what the patient wants or have to review their anatomy in person. And other times patients just choose to come in, but that option should always be on the table. Some surgeons will also meet with patients 1 to 2 weeks prior to the scheduled surgery to just review everything again and make sure that they know exactly what to expect for the recovery process. That's not done by all clinics, but that is an option in some clinics. So typically it's about 1 to 2 appointments prior to surgery, but sometimes it can be more. So take, for example, a hair transplant consultation. So patients who come to me and want a hair transplant will do an initial video consultation, and sometimes it's determined that their hair really isn't stable, that they're not on any medical therapy, and I don't like to do hair transplant surgery on patients who have no stability to their hair loss. I want that stabilized so I can build on a stable foundation. So if there's no stability, then we'll put them on medical therapy. Then we need another visit, say 3 to 4 months later, to determine if they're a candidate for surgery. Now at that visit, they might be on medical therapy, but things still haven't stabilized and we might have to change their medical therapy regimen. Well, in that case, now they're coming back a third time to again see if they're now a candidate for surgical planning. So that's an example of someone who may have had 3 clinic visits before scheduling a surgical procedure. Is plastic surgery a good career? What is the process like to become a board-certified plastic surgeon? It's a great career for the right person. Firstly, it's a competitive career, so it's not something that you just choose as a backup option. You really have to want it and fight for it to even get into the specialty. If you're doing more cosmetic type procedures, then you need to have an artistic vision. And that's something that I don't think can be completely taught. You can improve your surgical skills, but the artistic vision is something that I truly believe that some people have and others don't. And this goes also for staff as well. So when I hire, especially for my back-end team that helps me with the surgeries, I'm looking for individuals who really can see things artistically and are not just there to do kind of route tasks, but they're really thinking and are really seeing how do we optimize and deliver the best aesthetic result. And also you need to have a sensitivity towards people's feelings and their emotions about something that's bothering them physically, because this is a field that is very much involved in people's emotions and you need to care about that. And keep in mind, it takes a long time to become a board-certified plastic surgeon or facial plastic surgeon. First, we go through 4 years of undergraduate schooling, then it can be 4 to 5 years of medical school, followed by 6 to 8 years of residency and often fellowships. And then it usually takes 2 to 3 years of independent practice before you can actually be board certified. So you need to really want it. Does getting a hair transplant hurt? The numbing shots are never enjoyable, but the pain from them can definitely be minimized. So it's important to inject slowly. It's important to use smaller syringes with smaller needles. Also, the proper solution composition can help reduce pain. And of course, the proper location of the injections is relevant. So you need to understand the concept of regional blocks. So you need to know where the nerves come from and where they're going so that you minimize the number of injections that you're doing. Other than that, it can be a lot of time in a chair and some people tense up from that, but frequent breaks are possible if needed. The recovery from a hair transplant is rarely painful. So overall, if performed well, a hair transplant is not a traumatic experience to go through. But if proper numbing is not performed, it can be quite uncomfortable. In my practice, patients are always telling me how the day was never as bad as they envisioned it when they first came in for their surgery. And we actually have a live hair transplant that we recorded, I think, about a year ago. So make sure to watch that video to actually see someone getting numbed and as they're going through the surgical day, if you're interested. Will my medical insurance cover plastic surgery? Most cosmetic plastic surgery is not covered by insurance. However, if a functional indication can be proved to the insurance companies, sometimes it is covered. So some examples include functional rhinoplasty. If there's a breathing problem, let's say from prior trauma, they might cover some portion of the septoplasty and sometimes even a rhinoplasty procedure in order to improve breathing. Now you have to often specify if there's a cosmetic element that you're addressing at the same time. So they'll just cover the functional portion, and then the patient might need to pay extra for the cosmetic portion. Another example could be an upper blepharoplasty. Oftentimes, if you have limited field of view because of the hooding of your eyelids, then you might get coverage for an upper blepharoplasty. But if you can't support that with proper documentation from your ophthalmologist, then oftentimes those surgeries are not covered. And keep in mind that some surgeons, like me, are not in network with any insurance providers. So you might need to do a lot of the paperwork and communication with your insurance company by yourself. So if you're not sure on the in-network or out-of-network status of your surgeon, just ask their office and they'll let you know. How do I know how many grafts I'll need for a hair transplant? First of all, it's not all about graft counts. Results can vary dramatically based on the thickness of one's hair, the angles and the direction of the hair, and the location that's being transplanted, whether, for example, it's on the crown or the hairline. Also, keep in mind that graft survivability can be quite different from clinic to clinic. So you can get 2,000 grafts in one clinic and see 100% survival rates, or you can get 2,000 grafts and see 60% survival rates. So of course, the number of grafts that actually survive and remain and grow will be very different in those two scenarios. And beware of clinics that are quoting you for the number of hairs rather than the number of grafts. Keep in mind that the average number of hairs in a hair graft is 2. So some clinics will tell you, oh, we're going to transplant 5,000 hairs. But in reality, that usually equates to about 2,500 grafts. So make sure you know what lingo they're using. In my clinic for consultations, I often give graft range estimates rather than a specific number, because the only way we'll know the exact number is once we start working, because we have to match the recipient site size to the caliber of your hair, and that will also change the number of grafts that we can put into a specific area. When can I exercise again after plastic surgery? This will vary greatly depending on the surgery that you have. But for all plastic surgery that I know of, exercise should be avoided for at least 1 week. This is usually done to prevent bleeding and also to lessen the load on the incision lines to reduce tension. But for some surgeries, the limitation might be for much longer, like 2 to 3 weeks or even longer. So make sure you talk to your surgeon in advance so that you know exactly what their recommendations are. What skincare regimen should I use after plastic surgery? In terms of wound healing, the recommendation is usually to use ointment on the wound until the wound is sealed, and then following that with 3 to 6 months minimum of scar gel. Watch our video on scar treatments here, and to get the scar gel that we give our patients, make sure to head to feelconfident.com. Keep scars out of direct sunlight for at least the first 3 months to optimize healing. Remember that some scar gels come with SPF built in, but some don't. But you will want at least an SPF 50 on your scars for adequate protection. And you can put the SPF right on top of the scar gel if it doesn't have it already. And if the scar gel has, say, SPF 30, then you're going to want to add to that by again layering SPF 50 or above on top of the scar gel that has SPF. Can men and women get plastic surgery? Yes, men and women can get plastic surgery. The most common procedure in men is a hair transplant, and for women, it's usually liposuction and breast augmentation. Facial plastic surgery for men does have the possibility of feminizing the face in certain cases, and care must be taken if that is not the intent. For example, I tell most of my lip lift patients that this is a feminizing procedure. So when a man comes in and he's looking for a lip lift, I think he needs to be aware of that. And so we get into a discussion of whether or not, it's the right procedure for them. Also, with a facelift, you have to keep in mind that the scars are typically around the ear. And for men who might have lost a lot of hair or might eventually lose more hair, those scars might actually be more exposed over time. So that's one consideration that we think about in men and in male facelifts compared to women. Also, with hair transplants, hairline design is in some ways gender specific. So we factor that in when the patient's there for their surgery and they're looking for feedback on how should my hairline look. What is the difference between FUE and FUT hair transplants? We have a full video on the topic, so check that out. But let me just give you a summary here. Keep in mind that the implantation process of the hair transplant is generally about the same. What changes with FUE versus FUT is the harvesting method, which is how we get the grafts out. FUT removes a section of scalp, typically from the back of the head, and involves suturing to close the wound. It's most commonly employed for women these days because most women don't want to have a big shaved area on the back of their head, and with FUT that can be avoided. It can also be good because women tend to have diffuse thinning of their hair over time, so taking the hair from a specific region is usually better than spreading it wider with an FUE procedure. FUE harvests one graft at a time and covers a larger area to minimize the dot-like scars that occur in the donor area. 98% of men in my practice are getting FUE hair transplants because they're looking to avoid the linear scar. There are some advantages to FUT surgery, so if you want to learn more, make sure to check out that video that I referenced. What are some common misconceptions about plastic surgery? One common one is that people think that it's only for the rich and famous, but you can find quality plastic surgeons at all price points. Once again, we're going to have a beauty expert section on feelconfident.com, so that will be a great place to go to help you figure out which plastic surgeons might be the best fit for you. If you had a phenomenal experience with a plastic surgeon in the past, please make sure to leave their name in the comments section, and some of those surgeons might end up making our list. Another major misconception is that some people think that all plastic surgery patients are just crazy and that they need therapy. Well, I can tell you from experience that that's mostly untrue. My patients tend to be very normal, very high functioning. Some are even billionaires who run major corporations. Most people considering plastic surgery want to look and feel a bit more youthful and a bit more attractive. And they're usually quite realistic preoperatively and very appreciative postoperatively. Another misconception is that all plastic surgeons live a very glamorous lifestyle. I can assure you that my life is not glitzy, and I'm there till the end of the day helping my team clean everything, and that sometimes includes scrubbing the floors. So when you own your own practice and you're trying to do the best work possible, you really have to go above and beyond for your patients, and that often doesn't necessarily come with any glamorous types of attributes. I hope this video shed some light on plastic surgery, and I hope it answered some questions that you may have had. If there's anything else that you want to hear about, please include it in the comments below. Thanks for watching.